Assalamu alaikum. Hello, this is Dr. Mona El-Sherbini, a medical doctor at Cairo University, Egypt. Together with my fellow researchers at the Mentoring Research Network at the Africa Community of Planetary Partners for Health and Environment, we are undertaking this study to revive the wealth of herbal medicine, calling for a renewed interest in traditional medicine research, taking into account the negative consequences of climate change on medicinal plants' biodiversity and availability. Traditional herbal medicine integrates many aspects of our provocations, the biological, ecological, social, and economic perspectives. On a micro scale, it is notable that medicinal plants are a source of innumerous nutrients, bioactive compounds like phytochemicals, with preventative and therapeutic potentials, mitigating various pro-inflammatory pathologies, non-communicable diseases, COVID-19 for example, and zoonotic diseases. Medicinal plants also have epigenetic drivers on human health. So, aside from the biological immune aspect, adopting a traditional medicine approach could benefit society by encouraging a more holistic healthcare, rescuing ancient knowledge and natural healing, being eco-friendly, promoting the plant-planet relationship with preservation of biodiversity, earth care, and connection. This kind of research for solution co-creation requires partnership between community herbalists and established researchers in order to cross traditional knowledge with scientific methodology and technological approaches. This would foster not only science translation but also decolonization of knowledge and demarginalization of traditional medicine, reinvestigating wealth of the African and Latin American indigenous knowledge systems are envisioned to provide healthy, eco-friendly alternatives essential for our planetary health climates today. Footage of our research group talking about the importance of medicinal plants will be included in this presentation.
Hello, I'm Vanessa Goss from Brazil. I see traditional medicine as a clever opportunity to address our complex global challenges. Its holistic approach brings together therapeutic potential from natural sources, values of spirituality and ancestral knowledge, foster biodiversity and connection with our planet. From being part of a coffee research network, I hope to be contributing with guidelines for policy and decision makers. As a dietitian and wellness mentor, I act encouraging the use of plants to heal. It's time to redesign our way of life with creativity, collaboration, and action in all scales. I'm so grateful for inVIVO Conference for bringing knowledge and awareness with this togetherness spirit.
Samuel Abimbola. I'm the co-director of the Mentoring Research Network and a member of the African Community of Planetary Partners for Health and Environment. Traditional medicine is not antagonistic to orthodox medicine. In fact, traditional medicine is the backbone of orthodox medicine. As such, I'm calling on all decision makers and policy makers to move away from discussions to action in order to save the planet and all its life forms, including medicinal plants. Thank you.
Eli from Rwanda. I'm doing my PhD on plant protection at Union Agriculture University in China. In this world, the most known traditional medicine is Chinese medicine. Traditional medicine is more healthier because it is directly linked to the nature. It's a natural product. It is our time to conserve, to restore, and protect our traditional medicine and raise awareness for traditional medicine as a sustainable tool and for our future health system. Thank you.
My name is Menzi Masego from South Africa. I work with traditional healers, use various kinds of holistic medicine, indigenous medicines, who receive the gift from either their ancestors or directly through their lineage, from their father, their mother, their grandfather. And then they go to an initiation school to learn about the properties of that particular medicine. So I also believe that traditional medicine simply works in a more organic way. It works with our body because we are also, it responds better to our organs, and it is also just more organic, and there are less chemicals in it.
I am Yusuf from Nigeria. These global challenges call for a renewed effort in traditional medicine research that puts into consideration the impact of climate change on medicinal plant biodiversity and availability. I belong to the Aquafi organization, where we carry out a secondary research on important medicinal plants in Africa. I pledge to raise awareness on the importance of medicinal plant conservation, and I hope the global decision maker at inVIVO Planetary Health continues this kind of conversation because it's an avenue for professional development.
I'm Iola Oladije, a microbiologist from Nigeria. Traditional medicine is important because phytochemicals from plants such as artemisinin, derived from Artemisia, have proven useful in solving some health threats like malaria. As a planetary advocate, I take it as a duty to educate local herbalists about the importance and risk of traditional medicine. I also recommend to planetary scientists at the inVIVO conference to collaborate in order to harness the bountiful potentials of traditional medicine for sustainable health use.
Jinja, a Ugandan, a member of Mentorship Research Network. The Ugandans were basically using a tree called Wabogia ugandensis to treat and manage this COVID-19, and it was found effective. This was by steaming themselves using this drug, because it was very cheap acquiring this tree.
I am Nyamongo from Kenya. Traditional medicine is part of our culture because we have used it before to treat various ailments. But climate change has affected us adversely through biodiversity loss. You can look around. This is an acacia tree. We've used it before, and this gum is very important for whitening teeth and all that. We are much interested in conserving the environment by encouraging people to plant acacia trees or other plants in their backyards.
Hi, I'm Nathan from the US. Traditional medicine is important to me because it illuminates our universal roots in nature. Given that this wisdom and these sacred spaces represent our collective heritage and nourished all of our ancestors, it offers real hope for restoring a harmonious balance between people and planet. I pledge to continue this work and to offer my sincere, heartfelt support. Together, we can showcase hopeful and healing synergies between cultural, linguistic, and biodiversity. Let's challenge each other to remain connected and cultivate community by truly celebrating diversity. Thank you.
An African COP gives us a good opportunity to address some of the issues as medicinal plants biodiversity conservation. So we are inviting all inVIVO scientific delegates to take an active role in the upcoming Climate Summit, Egypt 2022. Thank you very much.